Let's just shift our focus, but still in keeping with matters relating to this pandemic. Now, non-profit organization Corruption Watch has raised concern about possible mismanagement in the procurement process to get a COVID vaccine in the country. Now, in a letter addressed to National Treasury, the organization has sought clarity about transparency, issues of oversight, as well as the transportation of the vaccine. It says that it wants to avoid delays and corruption as seen during the procurement of personal protective equipment last year. Corruption Watch says it welcomes a detailed response from National Treasury in which they were transparent about their plans to avoid corruption. And joining us now is Karam Singh, who is the head of legal and investigations at Corruption Watch. Thanks for your time. Welcome to Morning Live.
Thank you, Sakina. Thanks for having me on the program.
Now, Mr. Singh, firstly, just in terms of what you are asking from National Treasury, and I know you say as Corruption Watch, this is based on our past experience regarding the procurement of PPE. But what exactly are you hoping National Treasury would furnish you and, of course, by extension, the nation with?
Thanks. Well, I think the main thing we wanted to get from National Treasury was we wanted to get an indication about what the plan is. So we're going to see significant amount of public resources mobilized to both procure the vaccine and to roll it out. And Department of Health have been very publicly facing around aspects of the plan. Of course, that's being challenged in some quarters as being insufficient, as being not a plan at all. But certainly from the procurement side, the information which has been coming out has been very piecemeal. We've been getting little bits and pieces. We've been hearing about 20 million doses procured here, 1.5 million doses procured from the Serum Institute in India. But we haven't had any sense about what is the framework in which that's taking place. So we really wanted to get a confirmation around the fact that it is being procured in an emergency way, in a way which deviates from normal procurement procedures, but that the principles around transparency, fairness, and equity are still guiding the process, that the process is compliant with the rule of law, and that we've learned something from the first round of the PPE procurement debacle in terms of ensuring transparency and in terms of ensuring oversight. So those were the types of assurances we were trying to get from Treasury. And thankfully, they did give us a response with some details.
So just in terms of that response that you did receive, if you're just able to speak to us a bit about that. And also, does Treasury actually have a specific approach to avoid procurement corruption for the arrival of these vaccines in the country?
Effectively, we're dealing with an emergency procurement situation, which is completely understandable under the circumstances. So there have been requests for deviations to procurement processes related to the COVAX facility and in relationship to the negotiations with the four main vaccine producers, AstraZeneca, Pfizer, Moderna, and Johnson & Johnson. They confirmed that that SAPRA approval is still part of this process. It's not really clear to us completely the sequencing. But then we also asked them about, will there be additional deviations from normal procurement processes in rollout? And they confirmed that indeed that is the case with regard to the storage, distribution, and transport for this initial period. So for the next three to 6 months. So, what's interesting is that Treasury in this letter is disclosing information to us that we've directly asked them about, which they haven't necessarily disclosed publicly. There hasn't been a proactive process like the Department of Health has about taking the South African public into their confidence that they're running a process which is corruption-free, which is why it's almost ironic that we get to a situation where we're talking about taxes and about how to pay for this when we don't even have the necessary assurances that the spending that's going to go to support this and the infrastructure is corruption proof. So, then we also asked about the oversight and the role that the Auditor General will play. They indicated that the Auditor General will be activated and that the Auditor General will be in a position to do, we're assuming real-time audits in the way that they did with the first round in the PPE. But then we also asked them, would the Auditor General have access to non-disclosure agreements that are signed between government and vaccine producers? And they punted on that. They said we have to direct that question to the Department of Health. So, the principle that we're trying to promote here is one of transparency. The more information that we have available, the more we can scrutinize the companies that are involved in the supply chain, then we can begin to look at issues to ensure that there is no collusion, that there are no politically exposed people involved in these deals, as we saw the first time around. And the lack of trust in this is really only because of the track record that we've dealt with in the past.
And as far as that information that you say Treasury has shared with Corruption Watch that isn't necessarily in the public domain, have you shared that on your platforms so that the public can actually have a look at that?
Absolutely. So that's gone up now on the Corruption Watch website. We've distributed to other civil society partners that we're working with. You'll see there are a number of articles now in the press today that are referring to some of these issues. And they're serious follow-ups that are going to be required, additional questions that we're going to have to put to the Department of Health and also going back to Treasury. But I think that the president has been clear on this. We need to have an outstanding a rollout program which can be scrutinized, which is above any kind of allegations of irregularities around fraud and around corruption. So the standard that we're asking for, the type of openness that's required from government in terms of telling us about their plan, is nothing less than our democracy requires.
Now, Mr. Singh, you said that as a Corruption Watch, you appreciated Treasury's transparency with regard to the agreements drawn up with the COVAX facility and the Serum Institute of India, as well as the donations from the Solidarity Fund. But let's talk more about that sort of transparency, because, as you said, we're still talking about non-disclosure agreements, but at the same time, we are now seeing reports emerging about South Africa paying a premium for a vaccine. So let's just talk about that. What are you satisfied about there? And, what about the questions that still linger around that non-disclosure agreement, agreements in plural, and of course, the pricing as well?
Yeah. Look, I mean, in terms of being satisfied, we're satisfied that we put specific questions to Treasury and that they responded to those questions, and they responded to them in a very thorough way. I think the question that you're pointing to is the broader plan, the broader understanding about what is this going to cost the fiscus? What are we paying for dosages? What types of agreements are we entering into with international pharmaceutical companies? And the dripping of information, the little bits and pieces that we're getting on a daily basis around the price per dose, the potential differential in prices that South Africa's paying versus other countries. These are not disclosures which we should be getting through the press, through the odd bits of correspondence to government officials. This is information which government needs to put out front. This needs to be a very open process. We need to understand what's going on in these negotiations. We don't want to compromise negotiations, but we also need to understand, are international pharmaceutical companies making profits, uber profits on the back of our situation because we're in a more vulnerable position when it comes to negotiations. We know that South Africa was not upfront around procuring large dosages. Otherwise, the vaccine would already be in rollout phase here, as it is in other countries. So, what we're really asking for is both compliance with the legal regime which is in place, which says you need to share information, but a much more kind of proactive disclosure of information and a more detailed plan, to understand, because the procurement, the kind of public expenditure and mobilization that's required to do this successfully is not just about securing dosages. It's about securing it. It's about securing the supply chain. It's about ensuring that a black market doesn't develop, that vaccines aren't stolen, that there isn't competition within the country around trying to get different kinds of vaccines. So, I mean, it's an entire supply chain. And as we, look at other countries that are beginning to roll out the vaccine, we can see the challenges that they're facing. Challenges about getting the vaccine from cold storage into people's arms. Those are challenges which we're going to face too. So, is government prepared for this? This is going to be a total society response. We're looking at something to the effect of the 1994 election and the 2010 World Cup. We're going to have to be completely mobilized. And it doesn't seem as if government is necessarily taking that total society approach in terms of engaging with a range of social partners to ensure that this process unfolds in an orderly way, which is free from corruption.
Karam Singh, we are hopelessly out of time. So I'm just going to ask you for a quick yes/no. Has government contracted a pharmaceutical company to import, store and distribute the coronavirus vaccine?
They have contracted with companies around the storage, distribution and transport. Absolutely. They're engaging with companies. They've listed those companies in the correspondence that they've sent to us.
All right. We'll talk more about that at a later stage, no doubt. Thanks so much. We'll go and have a look at those companies. Karam Singh is the head of legal and investigations at Corruption Watch, talking to us about the letter that the organization addressed to the National Treasury, in which it raised concerns about corruption once the COVID-19 vaccine is ready to be rolled out in South Africa.